Is deaf and blind, Martin uses adaptations to make his life easier at work. At home, he uses British Sign Language with his wife, who is also deaf. It allows the newlyweds to connect and communicate with ease. But often, when Denise has sought healthcare, she's been unable to express her needs without Martin by her side.
She's had to go into hospital on a number of occasions over the years as an emergency patient, and each time she's not had access to a British Sign Language interpreter, so therefore she struggles to communicate. I've actually witnessed my wife being questioned by medical professionals and giving incorrect answers because she has misunderstood the questions when there's not a British Sign Language interpreter present. So clearly this could lead to the wrong investigations taking place or a misdiagnosis.
Like Martin, Kate often had to step in for her late father, another BSL user, during medical appointments. In 2022, that meant she was the one who had to deliver the devastating news that he had cancer.
I had to suppress every emotion to be able to translate, and it wasn't just at that moment, it was right the way through his treatment, right the way up until he died. We never knew when we were going to get an interpreter, and also a lot of the information supplied to him was in written English, which he couldn't understand, and I became like the face of the NHS and always delivering the bad news. And I feel like cancer stole his life, but the failures of the NHS and the lack of access to that, the healthcare and the interpreters, stole time from us.
And today's report from the Royal National Institute for Deaf People shows these experiences are far too common in Wales.
It's really hard to overstate the impact this has on deaf people, to be honest. It's stripping them of their independence, privacy, dignity. It's really dangerous because even though family might have the best of intentions, they're not qualified to relay that information. So people are coming away from appointments feeling confused. That's if they get the appointment in the first place, and maybe missing out on really important treatment.
As the Welsh Government renews its guidance for the NHS, many say it's time for more than words, so that deaf people aren't left in silence when their voice matters most.